Next on the roundtable is Dr. Dana Ewels, 34 years as a board-certified pediatrician here in Southeast Michigan. He was also associate professor of pediatrics for Michigan State University and in the director of the residency program at St. John Hospital. Good morning, Dr. Dana.
Good morning. How are you?
We're great.
Good morning,
How are you this
Dana.
morning?
Very good. And after listening to the previous, to Jeff, it's all the more important that we talk about our faith as well as health matters.
Yes, indeed. Yeah, we have to stay healthy in order to work.
That's for sure. I just thought in our first discussion of 2011, it's very important to start with the basic issues. And I think that the important thing concerning our health matters is advocacy. Being an advocate, good and intelligent advocate, is so important to our families. It's important for our children as well as ourselves. The Lord blesses us as health providers with needed knowledge and physical abilities, and I think it's important that each of us needs to make good choices concerning our health care. Choices include the physicians that we choose that provide that care, as well as availing ourselves of not only quality care when we're sick or injured, but also ongoing preventive care to keep us, out of the emergency room and out of our doctor's offices and so forth. It's important for your physician. You should have a physician who's teaching you and providing you with good preventive care, such as in the areas of nutrition and exercise. And it's also important for him or her to care for us when we're sick and injured.
You're so right about all that. One of the things that comes to mind as you talk about this is people who nowadays, they consider advocacy basically internet research. If I go on the internet, I study up, I learn all about what I need to know, I go in, that's my form of advocacy. How does that affect the patient-doctor relationship, and is that a cause of frustration for physicians, or is that a blessing to physicians to have people come in educated?
It's a combination of both, Gina. I think that if we use the internet in a very intelligent and respectful way, it's an important tool. I like it as a physician. I like my patients. I give them websites in certain instances to go to, and I'll mention one here in just a little bit. But it's important for them to be able to go and look up things and to even use that that internet to find the quality physician that they want to use, because advocacy involves choosing a quality physician, know about his or her qualifications. It's okay to ask nowadays. If you're new to an area, contact the local medical center and get a list. They'll provide lists of both primary care and specialty care physicians, and then talk to new people that you know in the area and ask them about the doctors that they attend and go to. Involving ourselves in having knowledge and questions concerning diagnosis and treatment options that we receive it's important for us to ask questions. We should ask knowledgeable, respectful questions concerning our diagnosis and treatment. And, instead of just following directions because, years ago my mom always said, well, the doctor said, okay. But
well, Dr. Dana, I have a question right now for you.
Sure.
You mentioned that website for patients to get good resources. I'd love to know what that is.
That website is www.healthychildren.org. It's an excellent site where parents can go, and I'm talking primarily from the pediatric standpoint in this case, but they can go and look up subject matters of concerning certain illnesses, preventive care that we talked about, immunizations, the recommendations that are out there in 2011. But it's an excellent website and one that I think all parents should have at their disposal to use. But we need to ask these knowledgeable, respectful questions, and we can ask knowledgeable questions when we have some background on diagnosis and treatment. Get to know your children's physician, especially, and your own physician. Feel comfortable, discussing issues of diagnosis and treatment with them. I'm a big advocate myself as a physician for making a first interview visit. In other words, make an appointment with a doctor to come in, get to meet him, see how you like him, not just his qualifications, credentials, but his personality.
Yep, and that website, again, that you mentioned is www.healthychildren.org.
That's right.
And with that, we are going to take a break.
Actually, right? Dr. Dana, thank you for joining us. We appreciate it on the roundtable. We're going to be you're going to be with us each and every